Welcome to a muzzled chat. Everyone, welcome Jake. How you doing today, Jake?
Good, I'm good. Thanks for having me on.
As you guys could see, for the ones viewing, Jake is wearing a neck brace.
I am.
How's that going for you? Why the neck brace? What's going on?
About 3 days out of surgery,
Yeah.
just Monday, 2 days ago, I had surgery. I had a herniated disc in my neck, and had been bothering me for some time. So I
Right.
had a surgeon go and infuse that to take the kind of pain out of my arm and chest and the middle of my back. So kind of on the recovery path now, but not too long. It sounds like it'll go well. So not too long we'll be looking good.
Man, I'm glad to hear you look well. You sound well.
Thanks.
You're just a little, you're kind of a stiff lately.
Right.
Loosen up,
Right. Yes.
No. Yeah, it's crazy because you looked into a lot of things. You had steroid injections. You were doing therapy. I mean, chiropractics. And it's just nothing was really because you have a herniated disc.
Yeah, I have spinal stenosis, which is a thinning of the disc in your neck. So not only is it herniated, it's getting thin enough it's starting to pinch nerves. And if you let it go long enough, some people do. They fight it for long enough that your arm will start to atrophy, which means that you'll start to lose strength in your arm. And when you start to do that, it's generally kind of immediate surgery. Cause,
You had some of them symptoms coming on because you had tingling going down your arm, all sorts of stuff.
yeah, I had it in my arm, in my thumb and my index finger. I had it in my chest and going down my trap and in my back. So it's better to fix it early than wait too late. And I know everybody's situation is different, and some people are at a place where they can't get surgery, or they're not in a place to get it. Especially if you're older in life, it does become way more risky.
Yes.
Any kind of surgery. And so when you're talking about neck surgery, some people do have to just live with pain meds and steroid injections and physical therapy, and that's no way to live. But
no, it's not.
Some people don't have the option to get surgery. So I'm pretty young for the surgery, just by statistic. But playing sports most of my life.
That's what I was gonna ask. So some football.
Yeah, the surgeon probably said if he looked at it 10 years ago, the herniation was probably small and was there. It just kind of grew over time. So, and nobody gets their neck MRI'd until you have issues, so you wouldn't know that there was issues, unfortunately, until.
And it was pretty debilitating because it got to a point it was impacting your sleep.
Yeah.
And if you're literally not sleeping, you could go a little crazy.
Right. Yeah. That was one of the biggest challenges was sleep. One of the biggest reasons to get it was just to go back to sleep. And also any trying to pick anything up, it starts to be problematic. And then, my worry is that, what they tell you is that when you start to really start to pinch nerves, that one of the things is you may start to hurt other parts like your shoulder, your arm. And then, what happens then generally is your tendons start to tense up a lot and you don't use it as much, which can cause other issues. So sometimes if you wait too long, you actually, there's always a possibility, that you do something more than just the neck, and nobody wants that. You don't want multiple injuries off a single injury.
This is funny. My boomstick, it's just walking away from me. I got to make a modification. I'm going to sit here. I have to play with this whole time. But, man, well, thanks for joining, by the way, because, Jake here wasn't even planning on kicking off content. He just joined me in the studio, good friend of mine, and we were just talking about a lot of things, and we are 100%, on the same page as to... It's becoming more and more alarming with age and these life experiences as to, dang, how important our health is. So it's like we're finally waking up to what is going to be most effective on achieving the best bill of health. and now that path begins. Oh man, as you start genuinely doing research and looking into that, getting certain blood levels and certain things, like you start realizing a lot of even the corruption with insurance and how that's operating, and a layer to the issues we're dealing with, Western medicine and white lab coats, because it goes beyond what you're even dealing with here. Like this experience is just magnifying, like, you know what? I mean, I love how you were even touching on all these drugs that they were pumping you with just to do the surgery. Now it's like, I know you're on a good path to achieving a better state for yourself, because you're like, you just naturally were telling me, I want to look into more like cleanses and detoxifying my body, just because all these things I just even recently went through. It'd be good idea to clear the slate. And it's like, that isn't common American practice. Like, we don't think genuinely like detoxifying our bodies from like all sorts of things, molds, metals, uh, uh, parasites, right?
Definitely.
Because that's like an annual thing other countries do every year.
Hmm.
Just common practice, and we just don't do it here. But so tell us a bit about like your other, if you don't, I mean, you can dive into it as much as you want, but it's the same thing like I was dealing with, where with me, obviously we identified a freaking bioweapon, right? Lyme disease, and that attributes 110% to like my brain fog, my low energy, uh, low libido, all sorts of things, and with the extensive blood work in labs that typically aren't even done from your natural clinic. Like, throughout these years, there were times I would go in because I would constantly try to get additional things covered through my insurance. So even though I'm seeing naturopaths or whatnot, I would also schedule with the family physician doctor oh, we got more panels coming up, like I'll just go there because I could get more things covered through my insurance. But left up to them, they would do their own prognosis and their own what have you, and without even resorting. So you're coming in with these symptoms and issues, and like fatigue, and just like, hey, what's going on here? And they immediately, their solution, it's not even to do lab work. It's not to look into your blood. It's not to look into toxicity. So it's not to look at your nutrients or anything. It's literally all feeding big pharma. Like, it's a freaking joke. Like, what is it? That's not even tapping into any roots of any issues. You're just enriching big pharma. You've been indoctrinated to like big pharma has all the solutions. Like, that's pretty much what you've been experiencing too.
Yeah. So as part of this journey, one of the things I tell anybody who has any kind of herniated disc or anything where they think that they want to get looked at. One of my things is if you have insurance, do it right away because the process is very long.
Mm,
It takes you 3 to 4 weeks to get in to see a surgeon. Generally, because of the way insurance works, they're going to have you do physical therapy. They're going to have you do steroid injections,
mm,
unless it is so severe that they feel like you're at risk for something, which is generally pretty rare, believe it or not. Even tingling in the arm and stuff isn't something they consider severe. And it'd have to be that you're losing feeling in your arm or
interesting.
um, but the problem with it is you have to do all this stuff. It takes months and months and months, and then it has to be pre-auth by a doctor. By a doctor and then by an insurance company. So, one of the things that is hard is like me when I was struggling with sleep because I couldn't get comfortable and just couldn't get in a place where, one of the things I talked to my doctor, I said, hey, can I do you have any medicine that helps helps me sleep? Well, ironically, all them medicines are SSRIs.
Right.
They're trazodone, doxepin, Remeron are all SSRIs, and yes, at low dose they don't have the same effect as an SSRI to depression or anxiety. They're more built for sleep, but the problem is that I learned in this journey is none of that really helps, um, because it's really hard. Ibuprofen does not kill nerve pain.
Mm.
It does help with pain, if you know, hurt your muscle or you hit your finger. It doesn't help.
It's not a solution.
Yeah,
Barely a band-aid.
and there are some medicines out there, um, that are more built for nerve pain. Some people have great experiences with them. One is called gabapentin. If you've ever had any kind of nerve pain, even diabetics use it for neuropathy and stuff like that. And one's called Lyrica, and they're actually both good medicines.
Mm.
Unfortunately, they just didn't have the same effect on my situation. And sometimes long term use of them kind of drugs can lead to you know, addiction and stuff like that,
Right.
because they're also they're actually not built for nerve pain. They're built for nerve pain in the sense of they're an epileptic drug, and the reason they're an epileptic drug is because they calm your nerves.
Mm.
And somebody who has epilepsy, that's what they're trying to do is calm their nerves so they don't have seizures. That and so you're kind of like off scripting drugs to other situations to try to help somebody, you know, through this process. But you know, the more stuff you get prescribed and the more different drugs you take, you do start to worry about the long term or short term effects of some
Right.
of them drugs.
Gosh dang. Now I know you even mentioned to me, it's like, man, if I had 15, 20,000 sitting around, I'd be going out and doing stem cell. What do you suppose, why do you suppose it is we don't have stem cell here?
So there is stem cell in the U.S.
There is. Okay.
The Mayo Clinic does have stem cell. They only, my understanding is it's usually only used in the case where you have some disease so rare that it's kind of a last option.
Interesting.
Um, One of the challenges, my understanding is it's not been approved by the FDA for use in. You have to have some kind of disease. That you can't get it for, like me, for a neck issue. I've heard people taking it for shoulder, to try to rebuild their
I
shoulders.
wonder why that is. Because I don't know. Me personally, it just seems like, oh well, because the surgery side of things, and all the drugs, or people that are fearful of doing the surgery that end up on a life subscription of those drugs, right? Like they're just ruling out actual potential viable solutions that have thoroughly helped people. Like I know you listened to some of the Joe Rogan, right? And picked up on some of the stem cell he himself has done over in Panama and sent his mom out for, and all these other people that swear by it, you know?
Yeah, I think it's just it needs more advanced testing before you roll it out to the public, because that's what they're saying. You know, yeah,
Oh, of
right
course
now
they
you
would.
would have to go to Mexico or Panama, somewhere else to get it done. Um, One of the big, I think, misconceptions of stem cells is it actually comes from the umbilical cord of birth. That's where they pull um, the
So it's not
stem cells.
from like a fetus.
Yeah, it's not from a fetus.
Right.
It's not from anything like that. Nobody'd be okay with that. I don't think
Right.
that'd ever be approved. But it comes from the umbilical cord, and some of the world-renowned research right now is being done in Panama, and my understanding, and you can get stem cells that are like 2 to 3 days old, and that's why people go to Panama, because they want them to be young. And you even heard like um, that people now that take their umbilical cord of their kid and they store it.
Oh, no kidding.
And I've heard of cases where some people have their daughter or son might develop leukemia later in life, and that can actually be, the stem cells can actually be pulled out and reused to try to
No
recipient.
kidding. Oh,
So
wow.
there's, I think,
Something
you
for
know,
us all to look into.
yeah, I think it's I don't think we're that far away.
Yeah.
I think in, you know, the next 5 to 10 years, I think it's going to be on the forefront, and they're going to be using it a lot more
Yeah.
to try to cure diseases, which will be good for a better future.
Well, that's why it's so important we tear down the corrupt system so we could get to actually having more solution based options for everyone, because I'm sorry, a life prescription of pain meds, I mean, that's just, yeah, no quality of life to live. It's, and then surgery, luckily here has, we do have some of the top world renowned surgeons, in the world. And thankfully that has, gotten better, I guess, throughout all the years. But gosh, if we have any other solutions that, and there's been a lot to that, where Western medicine was only giving a lot of people just those options, and through stem cells or through other things, they were able to avoid, having surgery and things like that. But I know you exhausted your options within your budget. Um, but yeah, that'd just be important for us all to get on board to ensure more solutions, right?
Yeah.
Here, I'm gonna mute us just for a sec because I want to ask Jake here if he wants to dive into another topic. One sec. Okay, getting Jake's consent here a little bit, but both of us as men have dealt with low T, and it's interesting because earlier on, like, that's kind of what I was speaking out on, like that I was even using Western medicine a bit for, to keep tabs on a bunch of the baseline levels as I'm going to these specialized doctors for Lyme treatments. Because it was 4 years ago with that positive diagnosis, that was the first alarming, like, testosterone number I saw. I was like a low 400. And I was like, okay, now I'm curious. So I started doing my research, and I was like, this definitely, I know, because when I look into low T for men, it testosterone's our blood force, So a lot of the symptoms, like just low energy, the same things with Lyme could be attributed to. So I wanted to rule that out, right? So, but I also wanted to naturally address it. And some of the doctors were saying, hey, as we treat the Lyme, your body might very well fire up natural production. So I was like, okay, well, it's low, as I researched, because the average for that age should have been like a high 600, 675 roughly, and I wasn't looking at new age graphs. I was going back because they're trying to change everything, and lower numbers and wider ranges and things like that. So, I guess long story short, I ended up doing everything natural I could, from supplements like zinc, um, tonka ket ali, some mushroom things, like not the psychedelic kind, but everything that was supposed to boost testosterone, like DHEAs, certain meal protocols, workouts, even. And fast forward, it's like my testosterone was only declining. And we're doing detoxifications on things like BPAs that can have been proven to lower men's testosterone. So it's just like this losing battle. So it finally got to a point, I need to supplement testosterone, like get on some TRT. And Western medicine was not a solution, because it's crazy. Like, some doctors' markers, it's like 250 or 200. You have to be below 200 for that doctor to even say you have low testosterone. And their range is like 200 to like 1,000. But 675 being the average. So they have no problem saying if you're 7, 8, 9, you're high. You're high testosterone. So you just deduct from that average what they would consider high: 500, 400, 300, right? That's low. Like three, yeah, it's all low. But they won't say that because their marker, it has to be below 200 for them to consider it low T. And I remember one of these Western medicine docs just correcting me, you don't have low T. I was like, oh my gosh. Like, and I started going through the numbers, and how could you not say it's low when this is average? You'll indicate this is high. So by that same standard, like, this is less than ideal and it's low. I might not be making your marker low in what insurance deems as low. But anyway, long story short, they wouldn't they wouldn't, they couldn't, I guess, even through the insurance and stuff, like even consider. And once again, their solution for me was SSRIs. Is unbelievable. I was like, you are not in it. You're in it for profit. You are not in it. And you're indoctrinated. Maybe your heart's in the right place. That's debatable, but it's irrelevant because this is not a freaking solution. So luckily, folks, there are doctors out there and clinics out there that are actually in it for the right reasons. And luckily we found some of those. And it is astronomically helped me. And I know for you, um, you're just getting started.
Yeah. One of the things you have to consider is you just can't even go into your doctor and say, "Hey, I want a testosterone test." You have to have symptoms
Right.
of testosterone loss. Also, um, you know, I do think that there's a misconception that, um, you know, especially if you don't have symptoms, some people, even though your testosterone may be lower, doesn't mean that you need replacement. Some people who are probably 500 can probably find more natural ways possibly to get it up,
Possibly.
possibly. But when you're low enough, when you can't move the needle and you've tried everything, yeah, I mean, there's really only testosterone replacement. That's all there is you can do. One of the things that I think really hurt mine was the fact that going through this neck issue and this disc herniation was a lot of inflammation in your body, which really starts to really, in many ways, kind of fight against your body, and so it starts to really go down. So some people will see that from what many doctors have told me is that when you go through like a sickness or something like that, it's going to be lower. Some people will build it, um, but lifestyle and diet and all that doesn't fix always all them problems. So you do
Right.
have to have the symptoms. It does have to be at a level that they deem as treatable, and then at that point, the same thing. There's kind of this back and forth about if it does treat anxiety and depression. Um, and one of the things is it may not directly fix that, but I think there's mood and there's libido and
It's
more
a
energy and
yeah.
more focus that will help with them parts of your life. I don't know that it's too early for me, but that it'll fix all them, like just in. I think anybody who's looking to get on it, I think yes, definitely go to a doctor. One of these subscription-based clinics. There's probably great ones out there, but just making sure check with a few of them. Make sure you're getting a good deal. You're just not getting like a put on a subscription plan where they're just charging you a bunch of money and you
For
don't
those,
see a lot of
yeah.
like a lot of improvement. So, and there's great ones out there. I'm sure. I'm not saying there's not, but with all of them popping up, you want to make sure you do something, that you can stay in it for the long term. You have somebody who has your best interests in mind,
Yeah.
and something you can do, for the rest of your life. Because it's most likely that it's not that you can't get off of it, but if you do have low, it's probably something you'll have to do even maybe less and less in the future as you get the level to a healthy level. But
Right.
it won't be something you'll be able to just quit doing someday, and it's just going to take off. Um,
Yeah, there seemingly were all those health, men's clinics seemingly erected overnight due to this being not a new alarming topic for men. A lot of men have noticed and have dived into this, but then again, a lot aren't in the know and they're still following the white lab coats and just kind of traditional medicine and getting on SSRIs for these issues that is not the root of the issue. And there's a lot of things to look into. So it's interesting. So yeah, on that point, just to wrap that up, is like there are doctors that will work with you and keep things on the relative cheap because the TRT is a very affordable product. But like these men clinics, like they'll $200-$300 a month like prescription, like kind of like one stop shop, easy, but it's all out of pocket and it's just a lot of money. And who can sign up for that for life? So to find these other doctors that actually see it and they know because they've done it with a lot of certain clients and they've seen the difference it's made in their lives. So they're like, wow, this is one of the root of the issue. And it does kind of even bring up a bigger question. Why is it men's testosterone is deteriorating across the board? You know, like, seems like something strategically being done because they're trying to withhold even the proper solutions for that issue. But oh, get me back on topic. Okay, so because it's interesting. Like, you experienced the same though. Like, you went in with these symptoms, you're expressing these symptoms, and Western medicine's solution for you was big pharma.
Is SSRIs, yeah.
Yeah.
And um, and I'm not saying that SSRIs are not effective for some people. They probably do help. But
I don't know. Debatable. Yeah.
yeah, some people. I mean, I've seen good results, and I know people who've taken them who've had who says it's helped them. And if it does, hey,
I
but
I I see it as band-aid because the reality with those individuals, like, this is the bigger point to be had, because you go in with these issues, the doctor, and this is where I believe it blows holes in Western medicine entirely, because the doctor, he only spends like 10 minutes in there with you, if that, 5 4, right? It's their, whatever you call them, right? Oh, they're taking some of the report and your vitals, and then, okay, filling out a chart. And then it's like he comes in, and this, it's already going to be the solution, like his solution, and the only, like, so you could be a new patient in there, and then you're just coming in with these symptoms, and that's the solution. Not, they're not even ordering the panels. It's like we both had to go in and request blood work, request a testosterone, like, hey, I know that it's also attributed, and I know I'm getting a little older now, and I want to know where I'm at. I don't want to be ignorant, so I could properly evaluate and assess my situation and start seeing what's going to benefit me. So the simple fact, I'd venture to push back on that and say, hey, you know what? They aren't good for anybody until you take some other steps first. And if those steps fail, then potential viable option down the road. But because the reality of it is, like, to look not just a basic blood panel, to look at your nutrition, like your nutrient levels, right? Because, like, even if it wasn't like low T, we don't know. You're going in there, that doctor resorting to a pharmaceutical versus being like, hey, let's see where your levels are at first, because it could be deficiencies, right? Let's order, if he really knew, let's order that and look at toxicity reports. Let's look at mold and other things that could also attribute to these very same symptoms. So it's actually now, versus just basing things off of symptoms you're dealing with, you're looking at root of issues as to, oh, are you properly nutritionally balanced? Are you hormonally properly balanced? Are you not in excess of metals or molds or plastics and toxins that also negatively bring all these things down in these conditions upon you? Because that naturally, now we're talking about a lifelong solution, because lo and behold, for so many, because it I've also known people that have had SSRIs that did say, hey, for a moment in time it did help, but it come to find out it wasn't a solution to my issue, and I was able to entirely get off of them, because once we found out these things, and it was years later, and there's damage done with a lot of these pharmaceuticals that now they're fighting in additional things to cleanse their body of and heal their livers and chemical, like, mind and all sorts of things. So
yeah, definitely. I think it's
yeah.
if you really read even on SSRIs, they're not. They tell you that they're not for the long term. Most of them say 6 to 12 months. Um, but I think it always goes back to that's why it's important to also know where it's coming from. If it's
Mm.
coming from your life or your environment or a stressful situation or or something like that. Yeah, when you go to jump on some of these type of drugs, you got to know the side effects. You got to know that it may not be a long-term solution. And then there's also the challenge with getting off of them.
Right.
And at the end of the day, at the end of the road, SSRIs really just boost serotonin in your brain, which helps control the mood of your brain. So they don't in any way, like you say, fix a problem, but it's more of trying to help fix depressive and anxiety symptoms for the most part. And
Right.
and there's always going to be um, a need for an SSRI for people who have tried everything and they just can't, and they're looking for, other ways, And then when you start to get into the more advanced, more of the psychoactive drugs, that's when it becomes even a little bit more dangerous, when you get into the Xanaxes and the volumes and stuff like that. They have a immediate effect, but they're very addictive and, and the long-term effects can be situational. So I totally agree. I think you should do blood work. You should do
Mm-hmm.
everything first. Make sure your hormones are in place. Hormones play a huge role
Yeah.
in your overall mood. And everybody, especially men, they kind of peak in their, in testosterone and in their hormones in their later 20s, and then it's just a slow decline.
Yeah.
And so I think hormones are a big part of it. Like you said, blood work, getting your vitamins checked, make sure everything's and if all that's good, and you're at a healthy weight, and and all that kind of stuff, and you may have to consider alternatives for a short term if you
Yeah,
can.
for short term. Yeah. I mean, eh, everyone's situation's just uniquely your own situation, right? I'd venture to say a good benchmark and a standard we could actually have for those doctors is if we go in and they're feeding any pharmaceutical without looking into anything, new doctor, find a new doctor. If another benchmark would be if that doctor doesn't ask, like with any of these type of issues, they're not asking, well, here's a piece of paper, write down, could you, or fill me in, what is, what do you eat? What do you eat? Fill me in. Like, you know what I'm saying? Like,
Yeah.
what's your breakfast consist of? Your lunch, your dinner? Like, where do you go? Where are you getting your food? And if someone's like, "Whoa, I eat McDonald's for lunch every day," if I eat, like, they're your issues because it's not. You're not just getting your nutrients. You're not. You're filling yourself full of things your body can't process. Proven. Like you see, uh, Supersize Me. That man went from above average health, above average, all his levels really well, just even at basic levels, to within a month of only eating McDonald's, near like he was gonna die
Yeah.
if he continued what he was doing. His body was dying. His energy was suffering, depression, all of those things were setting in. Weight gain, just out the gate. It becomes very telling. So if your doctor isn't asking and he's going to those solutions, like, that should be a benchmark. Like, he's just indoctrinated. He doesn't know any better. Then again, his heart could be in the right place, but if not, the majority of them are arrogant know-it-alls. You know, I'm sorry, the white lab coat to me has lost all respect. Like, it's I'm sorry, you're just not getting it because you got a piece of freaking paper, right? Like, it's and that's minimal. Like, that's minuscule. In fact, like, it's cool to see doctors now actually being like, I'm in remission, like, actually from the indoctrination, so I'm having to, like, re-educate and learn against because it wasn't helpful. It was actually damaging to fulfilling my Hippocratic oath and actually providing real solutions for people. So I use your discernment, right?
Mm.
But if these doctors aren't doing these type of things, like that's the biggest like alarm I want to say, because at this point, because so many families, they're still blindly entrusting in these white lab coats, and not just on behalf of themselves, but on behalf of their children. So once again, without lab works, without asking what they're eating, these children are eating, without any lab works or toxic reports, they're now, oh yeah, ADD, ADHD, here's Adderall, all these different things that's just very damning if you source the right information. It's insanely messing these kids up.
Yeah, I think it's definitely, before you take any, you know, drug, I think you should just look at the side effects
Right.
and see what that is and see if it's right for you.
Right.
You know, like James said, it's probably a good idea to, you know, go through other options. Make sure you, work through all the options you can
Right.
before you start taking any kind of SSRIs. Like he said, there's doctors who probably have their heart in the right spot, but
Right.
and they're also not. There's not a lot of options when you come to a doctor and say, "Hey, I'm depressed. I can't get out of bed. I can't do this. I can't do that." Yeah, they can run lab. They can do all that, but if they're trying to help you that day, then
Mm.
they're just going to give you an SSRI. And
Mm.
I also think, they're trying to help, but in the end, it's became, if you've ever met somebody who's been on it for a long time, will tell you too that they become less effective. Just like anything, any drug you take, and there's a
Right.
maximum amount of milligram you can take,
Mm.
and once you get there and your body gets immune to it, just like anything,
Yeah.
it's going to have less of an effect. So you always have to consider that too, and that's usually why they don't recommend them for the long term.
Right. I've grown to respect the doctors that realize, and it usually takes some years, right? I got another question to ask you off air. I sat here, I think we might have connected on something, but I'm like, oh man, I need more consent. But because then again, like my heart goes out to a lot of those in the field, like, they're really the majority. I mean, at the end of the day, for a lot of them, it's just another job. It's about money, but bulk of them, it's been a selfless journey, and I don't mean to bash any of those that have their heart in the right place. And over time, it usually takes over time. Is like, wow, we're not seeing with this. This isn't really a solution. So they actually, instead of like take the arrogant stance, like doctor, like don't forget the doctor before the name, like one of those that just takes offense when you're like, oh, excuse me, doctor, sir, I forgot, but they humble themselves and they're like, you know what, I'm going to continue the pursuit of my education. I'm going to continue, to practice medicine and go to these conventions, and you just constantly, like, I love those because it's like, then they, well, you know what? Oh, wow, nutrition has such a big role. Like, so they start implementing things into their practice, and they may still be like, you know what? This is an emergency 911 type of situation. Maybe they found the SSRI is a good beginning stepping stool as they integrate these shifts with their health, like their lab works and dietary, so maybe they start integrating in a really good way. That being said, let me ask something off air. Hey, we're back. I accidentally hit the intro button there again. But yeah, I don't know. Do you want to talk on any of that?
Yeah,
With
I mean,
anime, you could still talk about it with total anonymity, and then futuristically, I mean, it's something. If you even wanted to come on, I'd love to have him.
Yeah, I have a friend who's a doctor, and so
Right,
we're in a lot of talks. I'm somebody who's fortunate to have that
right.
kind of lifeline of somebody who I
That's cool.
grew up with. And one of the challenges is some of the there's so much. You may go to a doctor who might prescribe you an SSRI. You
Yep.
may go to a doctor who says that they're not going to because they just don't know enough.
Right,
Because putting you on something and then just hoping for the best sometimes, because that's the way the scenarios usually kind of work. Is
right.
they give you something like that and they say, hey, come back in 30 or 60 days and
Hmm.
we'll see how it's working. Or now you can message them and all this kind of stuff a little bit easier if you want to change something or you feel like something's not working. But one of the real challenges in medicine today is that they've said that what somebody learns today in about 2 years, there's going to be so many advances in medicine
Mm.
that to try to keep up with the new trends and the advances and everything is just extremely difficult, for
Wow.
a doctor. And they're good-hearted, like you said. It's a selfless job. They're trying to do their best. They're trying to help a lot of people. And I don't think any of them are trying to do anything that's um, unethical or trying to cause harm. I think they're trying to do with what they have available to them, the best situation for each patient. And though it may not look like that, like you said, when you only get 10 or 15 minutes.
It's so basic. The whole structure. Like so, those like it's wild because a lot of the ones I see now more so run under their naturopath, but they started with their MD, and then they have all these other accreditations like 4 times over. Their original education, and then continuing to this day. Like you're only seeing them, and you're sitting down talking to them, and they're getting to know you, and actually like, oh wow, okay, and then that's what led to this may be Lyme, like and these other things. So at the end of the day, I just want people to put themselves in a position that's getting more so to the root of the issues, so they're finding health, quality of life back, and in the most affordable, effective, like quickest way possible. And it's a tricky thing to navigate. Now, I know regarding your friend, this hit me hard, and it was pretty well. It was just cool to see because that means there's hope for these individuals because their heart is in the right direction. But you mentioned something along the lines, and you can correct it. But something along the lines of, if you asked me 15 years ago, um, whether what was it? It was about the testosterone.
Mhm.
You want to,
Yeah, he said, if you asked me 15 years ago, people used to come with testosterone problems. It was more of, it was kind of a lifestyle issue, right? It was diet, it was stress, it was
right,
all these things that led to it. But now you're seeing kids in their 20s and early 30s, seeing testosterone issues,
right,
which can be maybe blamed to a little bit of the modernization of the Western world of everything's fast food and all this.
right.
But he said that one of the challenges that he's ran into over the last couple of years is people that have went the route of trying to do it naturally. They're having
You
a hard
can't
time
keep
moving.
up.
You can't move the needle, and
Right.
so um,
Might maintain, or like in my situation, it was still deteriorating and tanking.
yeah, and then so he said that it's very difficult without some of the replacement therapy today to get somebody to a healthy level in a
So it
reasonable amount of
shifted
time.
for him where it's like more so where before it was lifestyle. Now it's actually like, you know what? We need to supplement this
Yeah,
is a solution.
which will hopefully lead to a better lifestyle. And I mean,
Right.
I think the big thing that he's told me about testosterone is if you just take it and you don't want to change anything, you
Mm.
still may not see the full benefits of it.
Right.
If you don't want to go to the gym, if you don't want to live a healthy life, like it's not a cure-all situation where you just inject and you walk away and you
No.
feel energetic and you feel better. It's to enhance, uh, you know, what you already are
Well, and
doing.
it's not like people would even make it out to be it's a replacement therapy. Now people potentially, I mean, you're only getting uh prescribed so much that's going to last a certain amount, so you really aren't left to be able to really abuse it, and the doctors, the good ones, will monitor to ensure average or optimal, or even, hey, if you function really well on a lower than average but boosting it ever so slightly by replacing, so it's essentially just making up for what your body, where you should be naturally, and that's where it's like situational. And I've noticed astronomical positive impacts, even being around my average, even below my average. So I'm not even at the like optimal phase, but I've noticed how it's regulated my reactions, like ability to cope and deal. Like I'm a lot more, well, like even balanced in my day to day, and it's helped even with this other debilitating disease bioweapon. It's like it is the blood force. It's helped me engage in my days and go about it, and notice the increase in the libido, notice the increase in, like, the gym before. I was just forcing myself, going through the motions. I don't know how to explain it, but it was like you'd be working on a bicep curl, and that bicep was just like, it would be yawning as you're trying to push it to the max. It's like it's yawning. You're not even, it's not engaging. And, a few weeks after, with the replacement therapy, it would actually engage. It was a night and day difference. But people think, and the reality for me, like, once again, it's not just something to achieve even a fitness ideal, anything. No, it's more important, the function of life and fueling, like the blood forces of man, right? And I no wonder culturally, like, men are getting confused as women want to wear women face. It's the blood force of a man. So I feel like it could fix even a lot of the societal issues in men fulfilling the role we've naturally throughout history, get back to the baseline norms. And there's personally been other benefits too. Like, that's why I'm really excited. Hear more on your side of things as things
Hmm.
go on, and because you're in a better place in your mind, I'm sure you'll be able to articulate and pick up on things.
Hmm.
So
Yeah, I think one of the things with testosterone that, you know, I think it in some ways got a bad rap years ago because people were using it for the wrong
the
reasons.
steroids,
Yeah,
doing the
yeah,
steroids,
buying it at gyms.
getting a all meathead. It's not that but because you think about it, when you're properly introducing, and because, yeah, you're boosting your levels, your body's still producing X amount, but you're constantly getting your blood work done to make sure you're averaging the average, like you're baselining the average or whatever level was deemed. But if anything, it's just going to be slightly above optimal for some, that the average really didn't have that much of an impact at all, or negative impact with mood, things like that. And they're still lethargic, they're still fighting through some things. So some may, by a little above, find that reprieve or help balance, regulate them. So everyone's situational, but it isn't this abundant overload where you're gonna Arnold Schwarzenegger out. No,
Yeah, you know,
it's
and it's always good to
you're
work
right.
with somebody who knows your situation and knows what you're after. And the reason that's important too is because there's things that the testosterone can affect, like fertility and stuff like that. So if you're looking to have kids,
Mm-hmm.
it's probably not something you want to do especially not in high doses. And
Right.
that's why you need to work with somebody who understands it and knows it, and have them
100%.
understand your situation and not just trying to get you to a healthy level. Because if you're in your 20s or early 30s and you want to you're still looking to have kids, it could affect fertility. And then
Right.
one of the challenges too is, when you get on it and then you try to get off of it, because you may have to get off of it for 3 or 6 months to do fertility. You're going to see that bump. You're going to feel that mood change. So that's something you have to be prepared for, kind of too.
Right.
So that's why you want somebody who really understands your situation, and that's why symptoms matter, and why you want somebody who you trust doing it for you.
Well, we need more people looking into this and championing the whole system to operating maximum on behalf. Like, it shouldn't be industrialized money wise, where that's the top priority for doctors, big pharma, the education systems. It needs to be health and wellness above all. Above all. And we, as the patients, as the funders to it all, have all the control and all the power. If we could essentially show up in the ways that are going to have that positive impact.
Mm-hmm.
So it's up to us, all of us, to not just ensure the maximum health for our current state, but our freaking children.
Yeah.
So if you're too self-serving, whatever, it should be self-serving. Like, what? So yeah, maybe if you're tuned into it selfishly, but if that's not enough, do it on behalf of the children. All right. You got anything else to say, Jake?
No, I don't think so. I think we covered a lot of good topics, and
I think so,
it was a
too.
good conversation. So thanks for having me
Let's
on.
tear it all down, folks. Help us tear it down. No, we could just ensure they're operating on behalf of our health, right? I mean, gosh dang, I'd like to see more of these doctors actually be held up to the oath they swore, because business-wise and just feeding big pharma, I have personal big issue with that, because this led to years of more being on the struggle bus than leading to the solutions. That I didn't even dive into the details as to how Western medicine got it wrong regarding my Lyme disease, because they weren't looking into it effectively. So if they can't do that with Lyme or testosterone, how many times are they getting wrong with the kids and all these other issues? Because it's corrupt. It's just not operating optimally. That's it. We could at least agree on that, I think, right?
Definitely.
Bless you, folks. Thanks for joining. We will see you soon. And look forward to Jake. He's going to be back.
Most definitely.
We'll be talking schmack on some other topics, no doubt.
Yes.
And I look forward to it. Take care, y'all.